So I'm a gynecologist. When you think of a gynecologist, you think of someone busy, rushing between clinics, operating, labor, delivery, calls, and all of that. So in the midst of all of this, I was also doing all of that back in India. I realized one day that, okay, maybe I am at the wrong side of the, spectrum, where I am just treating disease. That's the end point. No woman or man or child should fall sick is what I believe in. That may not be possible, but can I make an effort? Can I, go to the other end where, whether it is emotional wellness or physical wellness or just being, like Sumesh said, just like a baby. Be happy, be spirited, be up on the game, right? So how do we stay 2 steps ahead of ill health, take charge of our health, take charge of our well-being? And well-being will not happen only with a sound mind, because a sound mind is very difficult. But if you need a sound mind, you need to have a sound body, you need to have, the physicality has to be very well, and you should be feeling good about yourself in the morning, right? Like we talk about the 4 pillars of health. You talk about exercise, about rest, about good food, and about mindfulness. So today, because, Pink October, we all keep listening to that. You switch on your FM radio in the car, they talk about Pink October. You see it in the newspaper. Suddenly in October, everybody talks about pink, right? But my real, I'll feel that I have done something today if, when you go back, each one of you would at least have 5 women in your life. Our mothers, our grandmothers, our aunts, our sisters, our friends, at least 5 women. So if you could just pass this across to 5 other women, and they pass it to 5 other women, and men also, because if you're a woman, you should know this. If you're a man, you know a woman, but you still need to know this, right? So this is not gender specific. This is just spreading some amount of, whatever I know and I have learned all these years. 1 in 8 women could be diagnosed with breast cancer in their lifetime. And this number really, we are 5 or 6 women here. And if we have 3 more women, one of us could, there is a possibility of getting breast cancer in the lifetime. And in COVID, what has happened is that we were all told to stay at home. We were all told to be inside, be indoors, don't go out. We don't want to go to the hospitals. We are generally also not very comfortable going for a checkup, going for a health check, and because you don't want anything to be diagnosed. I was very much like you, right? You do a blood test, there is something in that. Oh my God, if I had not done this, then I would not know what's happening to me, and maybe I would have been better that way. But ignorance is not always bliss. So that is the whole, aim or intention of me being here, that because we were at home and we have, not kind of done our regular checks, now is the time that at wherever you are, whichever place you are comfortable, or if you are not in that category of women who would need the mammogram or the other testing, somebody who would need to pass on the message. And don't get me wrong, but even men get diagnosed with breast cancer, because men and women both have breasts, right? So about each year, 2,300 men also get diagnosed with breast cancer. And you're like, but how can you miss out something on this? It's so obvious. It is not something inside you. We talk about something in the stomach, or somebody getting a stomach cancer or this and that. Okay, they may not have had the symptoms earlier, but the breast is very much outside. You can see it every day, you feel it every day, we shower every day. How can you miss something like that? But this has sadly become the most common type of cancer diagnosed all across the world. But the good news is that we have tools. We have ways and methods by which we can get a diagnosis earlier, we can screen earlier, even before the problem becomes, very evident, and we can really reduce the mortality by more than 50%. In fact, the goal now is that by 2050, no woman should die of breast cancer, because we are bringing in this screening, and you can really prevent a cancer diagnosis each day. And how this started was way back in 1985. So a group of people like us came together it started sometime in 79 when they had this Iraq war and a woman had put up a yellow ribbon so that her husband gets freed. And then in 1985 when the AIDS and all that awareness started, they started doing the red ribbon awareness thing. And then in 1992 they had then you had the Betty Ford, who was the first lady. She had breast cancer. Then they started this as a week in October 1992. Estee Lauder, she got breast cancer, and that's how, when you make noise, then the noise gets replicated and you kind of, bring about more awareness, and then you start, and because our mind, when we talk about pink, you have this pink ribbon, you have this pink t-shirt, you have October, okay, this is going to remind me. Like in India, in March and April, we do our tax returns. So, you could even time your health check or whatever to some event like that. Okay, I'm investing in money in my tax returns. Now this is the time for me. That's how I do it. So every March is when I do all my health checks, and then I remember every March, okay, now is the time that it's pending and I should be doing this. And like I told you, I really thank you again, all of you, for being here, because you believe that yes, I should not be ignorant. This is not going to be just any other random talk on somebody giving me a lecture on breast cancer and then forcing me to do some test here and there. No, it's not that. There are no strings attached. I have, no conflict of interest. It's just very pure intention that you all go back. We own our body, we own our breast, and we also help just 5 women whom we know, and that's my job done today. Why do we need a screening test? Basically, I'm just going to be covering in a short span of time breast self-examination, ultrasound breast, and mammogram. These are the 3 ways by which we can, pick up stuff or pick up a diagnosis, which if we don't, then it, becomes a little late, and then you are going in from a condition which is treatable, curable, to something which goes on to a stage 3 or a stage 4 problem where it is. And mainly, I think there's a lot of fear also, because women fear if I go for a test and there is something which is picked up, and then so that is a main reason why, if I talk about the other test, something called pap smear, right? All across ages, countries, ethnic groups, women are like, no, it's painful, I don't want to go for it, I don't want to do it. But then again, like we take care of our other appearances, we go for our, you go for your facials, your spa, your manicure and pedicure and all of those things. Taking care of your body is something that we owe to not only ourselves, to our family, to our loved ones also. So the purpose is that you find it early before you, develop any kind of symptoms, right? For breast cancer, being a woman, getting older, we are all nowadays living longer, living healthier lives. So as you live longer, there is definitely the risk of developing breast cancer, and of course the lifestyle which has changed, right? So I know a friend of mine who is 28, and the only risk factor she was my student, very bubbly girl, really full of life, has a son. She's 28 and she has a family history of breast cancer. So she has been telling another friend that I need to do an ultrasound or a mammogram for almost 2-3 years. And one day the radiologist friend who does these tests catches her in the lift in the college and says, hey, come on, you're due for your test, you've been asking for it. 28-year-old with 1 child goes, does the test, she has stage 2 breast cancer. So that's too young, but then yes, right? So let's not go to the other end where the diagnosis is missed and you are, then you go through the whole surgery and chemotherapy and all of that. So as more and more people are getting older, and of course, and probably her only risk was obesity. So that's when we figured out that, being obese and all the kind of food that we're eating nowadays, you have a lot of preservatives, and this goes on for all the other health conditions also, right? The food we are eating brings in a lot of inflammation, and all of that. In COVID, we all got to know about inflammatory disease. You got so many forwards on WhatsApp. You got to know, okay, this is cytokine and this and that. But all that happens, and all that is detrimental to our health. So, of course, alcohol and smoking and all of these things, and even hormonal therapy sometimes. So, we may not be able to prevent the cancer, but we can, of course, find it early when it's easier to treat. Men also can get breast cancer. Lifetime risk for men is 1 in 1,000. So what do? We have this self-examination, we have a clinical examination by a doctor, and you also have a mammogram. So why should I do a breast self-examination? I think I'm all right, but you'll be surprised that unless you do it, so how do we do it? Breast self-examination is something that we can do once a month. If you get your period, you can do it after your period is over, because that's when the breast is not very, firm, and you're able to, so you are basically getting to know your own body, right? So you can do it when you're having a shower, and once you do it every month on a fixed day, say once your period is over, or if you don't get your period, you can just fix a particular day, say first of every month or first Sunday, and our brain is used to getting into habits, so then you form the habit, and when you keep doing this, you can be 75 or 80 and have a diagnosis of a breast cancer, right? So whatever your age is, every month you just fix a day, or do it after your period if you're getting your periods, and do it every month. You get to understand how your breast would normally look and feel, and then because that becomes a routine, if there is a change, it could be something that is just something is feeling different, there is either a swelling, or there is sometimes, like you see, there's an orange peel appearance, we say, so like an orange skin is, sometimes it could be just something there, or you feel there is a different kind of pain, or sometimes it's just some discharge coming out of your nipple. So only when you look for it, sometimes you find it. Like you would think, of course I will know before it becomes so bad, but you'll be surprised. There are so many women who come when they have either a 2 or a 3 centimeter or a bigger mask the size of a lemon, and then they're like, no, I don't know how I missed this, right? So it can happen at any time. So that is the habit, that either after your period, when your breasts are less likely to be swollen and tender, and if you don't have your periods or stopped, you've had a surgery or whatever, just choose any day, first day or last day of the month. And so you just need to understand that you have to examine your breast, and you also have to examine your armpit, because if there is some problem in the breast, the first swelling to appear sometimes is in the armpits, because that is where the lymph node drainage, as we say, happens. So you could just feel lumps and bumps, the lower part could feel like grainy, and then the other part may feel just like oatmeal. So once you do it every month, right, then you start to understand how the feel is, right? And how many women are aware of breast self-exam here, or even men, and are they even doing it? Have you?
We do the mammogram.
Mammogram, yes. Yeah. Oh, that's good. Every 6 months? Okay, that would be too frequent. Family history, okay, good, yeah.
I'm aware of self-examination, the process and everything,
but
don't do it regularly. Like
yeah, so probably you could just make a little note in your calendar, because that is how I do things. I mean, that's how I think we all do, because there are so many things that we are multitasking all the time. So just, we have the period app tracker and this and that, or if you don't get your period, then you just put it on first day of every month, and then you just, ting, that reminder will remind you. So you're taking a shower, and actually sometimes, we think, yeah, I take a shower every day, I know how my body is, but sometimes only when you pause, you look, you understand, okay, something is wrong, there is, something which needs attention. So like I said, a discharge or redness, or, some kind of, so it could just be anything. So you just think there is some kind of a dimple or a puckering, or, anything that is different. When you keep doing it normally, we will be able to understand the problem. And then you also, this is the next step, where you raise your arms, and then you are looking for the same stuff, because when there is a problem and you raise your arms like this, and then you may see some changes in the skin. So this is again one good way by which you stand, you raise your arms and look for the same changes. Doesn't take too much time, but like we say, we are all in a hurry every day. Sometimes that mindfulness in the shower is, so once a month we get mindful when we are taking a shower. Of course, any fluid coming out, and also lying down. So the same day when you're lying down also, you can just put your hand up and do a thorough examination on this side, and then you go around. First you go round, and then you go up and down, and that's about it, right? So if there is a problem, you would be able to pick it up when we are doing it in a regular basis. Now what do you do if you find something? So if you find something, please don't be alarmed. Not all lumps are, don't jump to the conclusion that it's cancer, because I have also seen women who find something and then they are scared to go. I find so many people who come to the clinic saying that no, I think it's fine, it's like this, it's like that, because Google is there, isn't it? We are doing a Google search on the lump and this, and no, it's not hard, it's not painful, it's moving, it's fine. So it could be anything, but then that's the time when you need to get professional advice. And of course, sometimes it could just be menstrual, and then once your menstruation is over with, it could also be part of PMS that we say, so premenstrual syndrome, more hormonal hormones getting in, and that can also cause your breast to become little more tender, and you may think that there is some swelling there. And now coming to the most interesting part of this, there's another modality called ultrasound, but ultrasound, usually the age of mammogram is at 40 for everyone, but if you have a high risk, we start even as early as 35 or 30. Ultrasound does not pick up stuff as good as a mammogram done. Ultrasound, we have all, I think, have an ultrasound for some reason or the other parts, and it's a very painless kind of a procedure. So if you're less than 30, there is a family history, or there is some other lump, sometimes common lumps or fibroadenoma, we may do an ultrasound. Mammogram is painful, I will not do it. That is what half the people say, okay? Unless sometimes like you have a family history, you are more worried about it, and you're like, okay, let me go and get it done. But trust me, I have had at least 3 mammograms in the past 4 years. It's not painful, it is not painful, it is not painful. That's all I would like to just reiterate. So just go and get it done, because this is the kind of clear image that we get to see here, and if there is any issue, something which is very, very tiny also, you can pick up. I don't have symptoms, I don't have a family history, I am not going to do it. But this is not just me, all the colleges, all the recommendation is that more than 40, regardless of, so 40 is the cutoff, right? 40 is a new 20, 40 is a new 30, 40 is a time when, otherwise most of us, 40 is celebrated as a grand event for men or women, right? We have a grand bash on the 40th birthday and all of that, but do remember that 40 is a time when you need to start doing your mammogram, because 75% of women who have had breast cancer, there is no family history. If you have a family history, you'll be cautious from even when you're 25, you'll be really scared about it. Okay, radiation. Again, people are like, no, you're giving me so much of radiation, right? I don't want to get, right? So you are doing it every 6 months? From what age?
38, I would say.
38.
38, yeah.
Okay. So what is your experience? Is mammogram painful? Do you?
It is not painful.
At all?
For me, I'm okay, actually. And then in the way they're very delicate when they
Very
do it
delicate.
to you, yeah. And it's a 5-minute thing, so
exactly.
it's manageable.
Less time than it takes to get a whole body makeover, no? You spend at least 45 minutes or 2-3 hours when you go for your cut and nails and all of that, isn't it? At least 2-3 hours. But mammogram is
5 minutes.
5 minutes. Thank you so much.
And by the way, we do have 2 cases in the family. That's why I take it very seriously. That's why today I'm with you.
Thank you so much.
2 cases of family history, plus some friends and friends of friends.
Uh-huh. And what was the age when they were diagnosed in your family?
Between 30 and 45.
30 and 45, yeah. So if you look at it, that's when the breast self-examination would help. Because if I tell a 30-year-old with no family history, she would say, I don't want to do a mammogram, why do you want to? Even hospitals like to do it only after the age of 40. But then that's when your breast self-examination, would kind of pick up something which is smaller. So, you that a mammogram is equal to 2 weeks of radiation that you get in your regular settings. How would you take that, right? And a chest X-ray is worth 1 week of radiation. We are in Wi-Fi environment everywhere. At home also we have Wi-Fi. We have one smartphone at this side, at that side we have our Wi-Fi routers everywhere which are on all the time. That 1 week of background radiation is equal to 1 chest X-ray. So maybe now we will switch off our Wi-Fis at night. That is what I do. Switch off the Wi-Fi and don't keep your smartphone with the Wi-Fi and the data on next to your head, because you don't know what kind of radiation is going on. And you pass it on. That's the whole plan here. So the constant background radiation, so about 2 months of radiation is what, and if you miss a diagnosis of a breast cancer and then you have to do all that radiation and chemotherapy and all of that, I think mammogram wins any day. right? And if you make it once a year at a fixed time, so 3D mammogram nowadays, like she said, it's really not painful. You know what happens? You go with the mindset, it's painful, then it's not painful at all. And it's not painful at all, like I told you 3 times. Okay, so when I was 40, being a gynecologist, I didn't do it at 40, to be honest. I did it only at 41. Because again, and when I did my mammogram at 41, it took me 1 year to collect the report. I'm going to the hospital every day because they called and told me the report is normal. Every time they'll say, the next building where I'm working at the mammogram facility, they'll say, doc, your report is ready. I'll be like, yes, I'll cross the place 2 times, 3 times, but that's how we become. Once you get to know it's normal, then we forget about it. So the important thing is, like you are doing it, keep doing it. Maybe 6 months would be too early, but that's absolutely your choice. But annual mammograms, and after 50, up to the age of 75 or 80, an annual mammogram is important, right? Because mammograms can also miss a cancer diagnosis, but at least you are picking up at least more than 95% of cases. You are, not. And after that, when there is a diagnosis, then the surgery is not removing the entire breast and all of that. Nowadays, we talk about breast preservation. If there is a swelling which is picked up on mammogram, which is going to be naturally so tiny, we just remove that part alone with the 2 centimeter clearance, and that's it. And then not everybody needs a chemotherapy or a radiotherapy, which is also not as drastic as, nowadays it's all become how you preserve and conserve the quality of life, right? So that's what by 2050, the aim is that we diagnose earlier and we don't. And of course, if we bring in more lifestyle changes, I'm sure this is going to become less common as it is now. Okay, last year normal mammogram, so I don't need another one this year. No, my dear, like you do an annual maintenance for your car, annual maintenance for your air conditioner, for your fridge, for your phone, for everything has an AMC contract nowadays. So that's how your body also needs it. So it's basically detection. So once every year or every 2 years is going to increase the chance of detecting a problem. Breast cancer hurts, I don't feel pain, so I must not have cancer, and mammogram hurts. To answer that question, most of the cancers may not be felt, let alone hurt, and the latest machines are really careful that they take care of your comfort. And you also, so when they do the mammogram itself, you understand, okay, they are screening this side, that side, and all of that, and it is so. That's why if you are getting your periods, plan it in the after your period is over. And it's scary to show up every year, right? But again, like routine exams, they are helpful for us to get to know our bodies better, help us see and feel our own body's baseline, so that you're able to understand, what's happening to yourself. Again, even if there is an implant, they take a picture in such a way that, you're able to understand if there is any problem happening. So like I said, my talk here is not just to talk about Pink October or breast cancer awareness or only, things like that. That is another important aspect of women's health. And, when we talk about cancer prevention, you have the cancer of the mouth of the uterus, which you can detect by doing pap smears. Again, pap smear is something which if you do every 1 year or 2 years, you will never be, stuck with the problem of a breast cancer or cervical cancer problem. And for young girls nowadays, we even have vaccine. Like coronavirus, COVID is a virus. The cancer which causes the cancer of the uterus is a virus again, right? That's HPV virus. And you have vaccines available nowadays. I'm sure in schools nowadays there is a lot of, I keep getting a lot of questions when I'm here. So HPV, the human papilloma virus vaccine is for all women up to the age of 40, 45. In fact, women can take it. So that this cancer of the uterus, which is again the lower part, the mouth of the uterus, that is again caused by a virus, almost 95% of cases. So there is a vaccine available. So if you take the vaccine, almost 95% you don't have a risk of, so we need to now start talking about shifting our spectrum from getting a disease, going to the hospital. So you should make us jobless. Okay, we should be sitting free, not having to do any kind of surgery, whereas move towards the other kind of spectrum where we are spreading the message of, health prevention, and especially when we have access to so much of information and access to so much of, health facility. Like when we go to the rural setup, right? There is a different way with which we are doing the screening or testing like that, right? In fact, here also in Dubai, I think in one of the malls, the Safe and Sound Initiative, then they have the pink caravan where you have these mobile units, vehicles which go around doing mammograms. But I think we all have access, and just that to find time. Now finding time, you have to find it. Time will never find you. So that's the key. Only 1 to 2 years you can do it until at least 75 to. But I have seen someone even a unit head, very senior doctor who was heading the health check department, in fact, where I was working before, at 76. Suddenly one day she's absolutely okay, and then she has a diagnosis of a stage 2 cancer. Right? But then you have to go through the surgery and all of that. So it can just, like you say, just be one step ahead of any disease, right? So we know the in and outs of so many things. You talk about PowerPoint, Word document, this, that, making presentations, going all out, knowing the latest stuff in Google and this and that. iPhone 13, when is it launched? This, that, the latest recipes, this, that. But then just know about your body, what are the tests available, just getting a health check. So that's how many hospitals, they have a complete kind of a well-woman check or health checks like that, where they do the blood test, the ultrasound, the pap smear, the mammogram and all of that, And there's another problem called osteoporosis. We will talk about that too. That's again a silent thief. You won't even know, and you will get all these aches and pains and all of that, and finally it would be osteoporosis. But by the time you diagnose it, when you're either 50 or 60 or 70, you will be diagnosed maybe when you have a fracture and you are immobile for 2 months. So so we will be having more conversation, more topics to talk about, and I'll be so happy to take any questions. Again, sometimes 10% of breast cancer is missed on a mammogram, but if you've heard of Angelina Jolie, so she had a history of breast cancer and ovarian cancer that is in her family, and then she went for, then there is something called the gene testing which we do. So these are certain genes. So when you have a strong family history, these are certain genes which genetically you are predisposed to getting either breast cancer or ovarian cancer. Again, the cancer of the ovary again is very silent. Okay, they celebrate September as Ovarian Cancer Awareness Month. There the theme is the ovary whispers. Okay, you will not even know. And so we have the uterus and we have 2 ovaries in the side, and this ovary also can develop a cancer silently. So how do you pick it up? Again, by regular checkup. So if you go for your mammogram, you're also going to go for an ultrasound, and then you can pick up that okay, things are fine. I don't need to worry for either 6 months or 1 year. Absolutely, The most common, see, that's what, when you have a breast cancer, for example, sometimes the so-called lump or the so-called swelling can be silent till it is, see, if I am doing a breast self-examination every month, I get to feel my breasts on both sides, and I am also looking, and even if it is as tiny as a pea, okay, I can, okay, something is different, I may pick it up. Or if I am 40 and I am doing a mammogram, you are picking it up earlier. But when you do none of this, you may get a diagnosis of a 1 or a 2 centimeter growth. By that time, what happens is that because this breast cancer is notorious for spreading very fast, so it will go to the opposite breast and it will just spread all across. So the signs and symptoms for any kind of cancer, for that matter, is very commonly it is loss of weight and loss of appetite and weight loss, right? Weight loss, loss of weight, loss of appetite is something, but then that happens little later when it's kind of spread. So the only way to up our game is, you don't want to be on a highway, your car breaks down, you are in the desert, you don't have gas, you have nothing, your phone is out of battery. How would you say you are lost in the desert, no gas, no phone charge, no tower? Whom are you going to call? How are you going to even tug your, and you have all been, this is a desert, right? Say you are between this place and Abu Dhabi in the middle of the desert, how are you going to, what are you going to do? Walk this way, that way, get all sweaty, probably not even make it sometimes. So that's why, you know, from today's 30 minutes, 40 minutes of talk, you are a man, you are a woman, you are an admin here, you are taking the video, you have come here because you have a family history, you have come here because you know me. If you know 5 women in your family or 10 or more, I'm sure you would. Just tell them, if you're more than 40, just go get a mammogram every year or every other year also. I know my own, you know, very close student, another girl, her mom, I mean, they had a family history, or so every 2 years they were doing the mammogram. Something, you know, after talking to me, she took her mother in just a year. So like you are doing it every 6 months, that's a good thing to do, fine, it's your choice. She took her in, she was not due for a year, but she did, she found a small little, you know, so being a doctor, she found her mother is, she knew it, okay, there is some problem with the mammogram, this is cancer, ma'am, so let's, you know, go ahead with it. Her mom is absolutely fine now, she's completed her. So if she had, you know, this is someone who is a doctor, who is doing a regular mammogram, so she's, you know, found some problem, or, you know, sometimes intuition or whatever, and found it early, and now she's absolutely fine. So it's just about being above or being ahead of the whole game. Yeah. So Angelina Jolie, because she has family history, these are BRCA1 and BRCA2 are certain genes. So blood tests are available for these genes, which can be done. And then if you have this gene, then you have a high risk of developing either breast cancer or ovarian cancer, and sometimes even the intestinal cancer and all of that. So then you can, you know, do the checkup a little earlier, say when you're 25 or 30 or things like that. And then, so she has undergone mastectomy on both sides and hysterectomy and removed the ovaries also, because very, very strong family history. So then, you know, that's a choice that you make. Mammogram is available anywhere, everywhere. You can just go and, because any standard place here, you have Emirates Hospital, you have so many places, you can just go. Now because see, all hospitals also project it as a, you know, like a package with a consultation, a test and all of that, and follow up. So just that we have to make it as a routine, which is what, you know, the intention here is. So thank you again, thank you so much for being here. So I'm not going to leave you. You all have to write down a promise that you are going to convince at least 5 women whom you know, who are either 35 plus or 40 plus, for a mammogram every year, and another 5 women or girls who are probably less than 40 for a breast self-exam every month. If that message is going across, my job is done. Thank you. Thank you so much.